But you can hang in with us if you'd like. Awesome.
He is auditing.
He's auditing. I love that.
I don't see the iPad. I don't see the picture.
Oh, I forgot.
That's all right. I forgive you.
The Finance Committee will come to order. Good morning, everybody. Are there any citizens that signed in? None, no citizens have signed in to address the committee. Move on to item 3, which is approval of the minutes from the January 24th meeting. Entertain a motion in that regard. Motion by Mr. Bose. A second by Mr. Nguyen. All in favor, please say aye. Opposed? Motion passes. All right, item 4, CFO report. Ms. Clark. Good morning.
Good morning. How are you?
We are well.
This morning, I would like to introduce you guys to our new VP of Rev Cycle, Rory McCready. He can stand and wave. There you go.
Good morning.
He and I worked together years ago in Lubbock, and he has about 27 years of healthcare experience, both at Covenant Health as well as Grace. There in Lubbock, and he's going to be helping out with all Rev Cycle areas. So he's over billing and collecting for the patients. Eligibility will roll up through him. He's also helping out with medical services reimbursement and the contract aspects of claim adjudication, and also with managed care. So we're really lucky to have him.
Great. Welcome
And
to the
he's
big city.
drinking from the fire hose this month. So glad to have him here. And then that was really the only thing that I was going to update you guys on, unless you have questions. I'll go ahead and go into the financials.
Why don't we go on to item 5, the financial update. Item 5A.
So our financial report, and I may try to cover just a little bit of the basics. Mr. Zimmerman, I know you're new, so feel free to ask questions throughout the presentation. It's easier for me to have a conversation.
He says he's auditing this course, so he's auditing this course today. We're glad to
Okay.
have him.
Okay, well, feel free to ask questions. So, but the way that we do our financial report, the first few slides are what we consider to be key volumes or activities that are driving some of our financial results for the year. And the first page is more about the inpatients. And we had a really healthy volume this month from admissions. They were about 2% higher than anticipated in our budget. And our case mix index, which shows how severe our patients are and the acuity of their care, has been slightly higher this year than in prior years. Also, on this page, we focus a little bit more on outpatient services. The emergency department is the largest place where inpatients come into our system. Although we were under budget for this month by about 5%. If you notice, we're also it was still a very healthy volume. And year to date, we're under budget by about 2%. Urgent care was also under budget, but these budget numbers in prior year were pretty aggressive. And this was the highest volume in urgent care since last January. So even though we were under budget and the box is red for being so, it was still a very busy month. And then, of course, our primary and specialty care clinics. Primary care is slightly under budget, and our specialty clinic visits are slightly over budget. And that's kind of been the trend most of this year. Invasive lab continues to be a very strong service line for us. As you can see, in January, they were about 14% ahead of where we anticipated them to be. And our surgical areas have begun to come back up to prior year volumes. If you notice in inpatient surgeries, they are about 10% ahead of budget, and that's this line right here. And then our outpatient surgery, even though they are slightly under budget, I wanted to point out that this was the highest outpatient volume that we've had in 16 months, so since 2017. And that is just really, there's not one specific type of case that's driving this volume. It just seems like volumes are over. For our psychiatric mental health, we look at our inpatient, the clinic visits, as well as the psych emergency clinic, which we also call the PEC. And all of those were over budget. I do want to point out that our psych clinic visits, you can see that this year's trend is much stronger, and that has to do with the way that we are discharging patients out of the PEC or inpatient. We're actually having them schedule their appointment upon discharge. So those volumes are going appropriately up. And my favorite page is the financial metrics. You can see that we're beginning to get some of the ad valorem taxes in, and so our days cash on hand, you can see this normal trend that it comes up, it peaks in February, and then I'll trickle down. So we're holding true to that. And our net AR days are staying pretty stable down on the bottom left. The FTEs per APD is a big driver for us. Over 50% of our operating expenses relate to salaries, wages, and benefits. Our end of year target is to have about 5.7 FTEs per adjusted patient day. It's kind of a calculation we do to combine our inpatient and our outpatient activity. So far, year to date, we're 4 months in, and it's 5.6. Compared to the 5.2, so we're in a favorable position. Our payer mix, it does not change from month to month, and this is a year-to-date capture. The way these percentages are related is based on charges. If we ran this based on our collections, our dollars, then our connection and our self-pay piece of the pie would be very, very small. So this is kind of heads through the door look, and you'll notice that we're still remaining close to 40% for our self-paying connection patients. They're right at 37% year to date, and then we have a large Medicare and Medicaid volume. And most of our commercial over here, this 15%, really relates to, we have a lot of high deductible exchange plans that our patients participate in. But that represents all of the normal commercial payers.
What would be the an example of other?
So our other is, it might be funded by grants or research dollars. And this is really a picture of just patient bills dropped.
Right.
So this doesn't represent all of our grant revenue. We have a lot of grant revenue that comes into other operating. This is just the patient service revenue component.
Like you said, this is heads through the door. It's not our collections. It's just heads through the door.
Correct.
What
If a
classification they
patient
are.
was going to have a $1,000 charge and they all had a $1,000 charge regardless of what they collected, it would be captured on the charge activity.
Yep.
And there's several ways you can look at it, but I think for our purposes, this is a good way. It tells you kind of how our patient population, what they're comprised of and who their original payer source would be. The JPS Connection program is, again, our county indigent program. Once patients meet the criteria, some of which have eligibility requirements based on the federal poverty guideline and residency within Tarrant County, we enroll them, and this gives them access within JPS to inpatient, outpatient, ancillary services, as well as pharmaceuticals. So we always see a natural drop-off in January. You can see that it happened here. Whoops, sorry about that. You can see that it happened here, and it happened again, and that is because some of these patients, the blue line represents the Connection Supplemental Program. So we have Connection patients that are uninsured, have no other insurance. We also have a secondary layer for patients who may have those high deductible plans, and when they access the health care, they're what we would be considered medically indigent, where they cannot afford that $5,000, $10,000, $20,000 deductible or copay. And the ACA plans re-enroll every January. So we see a natural drop-off in re-enrollment process. But I will like to point out, we had about half, we only dropped by 6% this year because of some new and innovative ways that we re-enrolled people versus last year. Last year, we saw a 13% decline in that 1 month. So I've asked Michelle to come. Michelle, do you want to come on up? I had anticipated we may want to talk about the Connection enrollment, but they really worked this year to communicate and get people re-enrolled on a more proactive. Every year, we find new ways to involve people. So do you want to tell them a few of the programs?
Absolutely. So we changed two processes this year. For our JPS Connection supplemental to insurance patients, typically every year they term on December 31st, and they're terming because their insurance may change come January 1st. In order to be on that program, it has to be a contracted plan with JPS. So we want to make sure that plan is contracted just in case it changed. So typically, if they enroll in January, they're going to expire in December. But for the supplemental to insurance plan, if they enroll in August, they're still expiring in December. So they're only getting 4 months of coverage. So what we did this year is we did an extension process. We verified, it's like 4,000 something members that we had. So we either were calling or as they came in the door, we re-verified their insurance to make sure it hasn't changed and had them self-declare that their income, their Tarrant County residents, and their household hasn't changed. If nothing's changed, we extended them for the extra 8 months that they were entitled to. So that helped our process a lot. We're going to requalify in August. Yeah, they're not getting an extra year or anything. We just gave them the year that they were certified for. The second thing that we did was the ACA. Everybody knows that the ACA penalty went away for 2019. Well, that was helped a part of our process with the exemption process. So if a patient comes in and if they go over a certain income level, which is 138% of the FPL, we route them to the Affordable Care Act to see if they can get health insurance, because we're the payer of last resort. If they go through that process and they get the health insurance, we help them with the JPS Connection Supplemental to Insurance Program. If they cannot afford that premium, that month-to-month cost, then we actually help them get an exemption with the marketplace. If they're approved for an exemption with the marketplace, one, they don't have to have insurance. They don't have to pay that penalty fee. This is in 2018 and prior. And then we can enroll them on Connection as long as they didn't go over that 250 income limit level. Well, now in 2019, there's no penalty. So we had to implement our own exemption process. So we have a JPS Connection internal exemption process. It is mirrored the same way as the ACA, and we did this only because we are the payer of last resort. We have to make sure that they don't qualify other insurance. So we implemented that process. That has helped tremendously, because with the ACA, it may take 2 to 4 weeks where we get a response if they're approved on exemption. if our process, we can tell right away. So we're able to enroll people a little bit faster this year.
So our eligibility department, and Michelle Haynes has been with us for
8 years.
8 years, and she's made some incredible changes, but we are not here just to enroll patients in the Connection program. We're here to try to find them any insurance coverage that they may qualify for.
That's correct.
So you screen for Medicare and Medicaid and some of the state programs.
Yes, and also grants as well. So we have a few grants that we screen for as well.
That's huge. And these folks here on the board are tired of me saying it, but what you're doing is so important, and thank you very much for that.
Thank you.
The other thing that Michelle has been a part of is the last 2 days, we brought a team in from Epic in Wisconsin. And Zim, for you, Epic is our electronic medical record system that we have. Epic's probably the largest, and we went with that years ago. And what we're trying to do is determine those upstream activities. And DT, this speaks a lot to what you've asked us over the years to look at. And looking at the 34,000 or so patients that are enrolled in our Connection program, even though of that population, not all of them seek their care at that time, but they do enroll. So our question is how much do we interact with them to provide them care, such as handling their diabetes problems or dealing with those social determinants or upstream activities that we can begin to reach out and help them get into the system or be preventative in our nature. So what we decided to do, working with our EPIC team that came down from Wisconsin and were with us for 2 days, Michelle and a couple other leaders, about 21 leaders of the organization, we all got together to try to look at that. And what we decided to do is to take our Connection program and really begin to manage that population in a variety of ways. And we'll give you more updates. We just started having those meetings, and EPIC was very supportive of it. Michelle did a breakout with them, and they now understand very much our Connection program, because that's different than most other healthcare organizations. So I think it was really helpful for EPIC, and Michelle did a great job. And I think that's going to be a big answer that we'll be coming to you with about how we manage that. When you start talking about population health and everything else, there's a key component to managing what we got, which we don't do. We just take them in, which is fine, but now I think manage them will make a big difference.
All right, thank you.
Thank you, Michelle.
Thanks for the question. Michelle does a better job explaining what she does. She's very passionate, and her team, if you ever have a chance to meet with her team, they love what they do and they understand why they're here. Our January financials for the month, we had a great month financially compared to budget. We actually came in at $3.4 million compared to a $920,000 bottom line. Most of that is due to some expense savings that we had during the month. If you look up inpatient service revenue for the month, we had a strong inpatient, but some of the outpatient ancillary services were a little behind where we expected them to be. So we had some underages in pharmacy, we had some underages in the ED, as you saw, but that's okay because you have some expense savings underneath that helps offset that as well. Again, this net patient service revenue is just related to patient billings. We also have a few other significant sources of revenue, one being our property tax or ad valorem revenue. We also have the Texas supplemental funding from the state that helps supplement our Medicaid population. And then we have other operating revenue that is kind of a catch-all beneath that for a variety of grants and GME funding, and everything that's not related to those top three falls into other. For operating expenses, again, the largest component is going to be salaries and benefits, and you can see that those were favorable as well this month. We did a really good job with holding overtime and also flexing our staff to certain volumes. Our purchase service and supply, yes. Well, if you look year to date, so the second line here is contract labor. And that's kind of the way that we budget for things. So we budget for all positions to be filled. We do assume there's a certain vacancy that kind of rolls through and churns throughout the year. But there are some key positions and coverages that we have to fill with contract labor while those positions are open. So some of this budget is for planned contract labor. What comes through is the planned plus those coverages as we're looking to fill full-time positions. So even year-to-date, this contract service is over budget, but hopefully we are also under budget in salaries. So those two kind of offset each other. It's a good question.
Before we go on,
Yes.
I didn't mean to interrupt you, but the number, I do want to highlight for everybody in the lower right-hand corner, which is year-to-date, we're a third of the way through the fiscal year.
Mhm. Yes.
And we're on our bottom line, which is, I just, we're doing it this year, that's really good.
That is critical. For those of you who remember, we closed this year's margin with just over $1 million for the 12 months. Now, most of that related to some changes in formula funding and items that were impacted back at the state level. But we were able to continue to operate at just above a break even. So for us to be in a financial position the first 4 months where we do have this level of, have positioned ourselves ahead of budget is a great thing. I will tell you, when I get in front of leadership, they hear one hopefully resounding thing from me is that any given month can change our financial position, and we put ourselves in a really great position so far. As we move throughout the year, and we're sure that there's not going to be any major changes, there are programs that we're holding that have been budgeted. You can see in the $6.2 million worth of savings, probably about a third of that is true savings that will not occur. But there's probably, $3-4 million that could be caught up later in the year. So as we become more comfortable with the financial performance, we'll probably catch up on some of these operating expenses. But yes, it's a great position to be in.
Just anecdotally, those of us that have been around here a long time, remember discussions that revolved around the FTEs per adjusted patient day. And 10 years ago, we literally compared ourselves to the marketplace, and the marketplace was shooting for a 5.0.
Right.
We looked at that and basically concluded there's no way.
Right.
No way we're ever going to get it. No way. We were around 7, 6.4, 6.5. And now here we are, 5.56.
It's-
Talk about the variables that impact this.
No question.
When we get that number down, it's 5,
Yeah.
it's really achievement. So Robert,
Yeah.
congratulations. That's a big deal.
Yeah, it's- And I appreciate the acknowledge of that, because the team has worked exceptionally hard, and there's a group of people that are not only watching that, and then that speaks to what we're trying to do to manage those patients that come in the door far better. We hope to be able to come to you with other additional savings, because the one thing that JPS is not going to get is a treasure chest of money. It's never ever going to be delivered to our door that says, oh, by the way, or we're never going to be in a situation where we make a substantial gain from our patient base. So what efficiencies can you create, or how do you manage what you got? So thank you, I appreciate that, Trent, and so does the team. Sharon and her team and everybody else has done yeoman's work to get that to that level. We're going to keep trying.
That is one of our major drivers. So, one of the other, we had Leadership Connection earlier this week, and I recognize the mental health team with some of our outside medical services, which is what the largest piece of some of those permanent savings. And just by, implementing some innovative ways to make those processes more efficient, they're saving $1.4 million year to date, $600 at a time. And so, it adds up very quickly. And, I think all of our leaders have really started to evaluate spend and, you might find $1,000 and it doesn't seem like a lot, but for 12 months, my bottom line was $1.2 million. And so it's all hands on deck.
Yeah, well, congratulations.
Yeah.
Okay. Any other questions about January? We kind of skipped around there, but, okay. So if you look at Acclaim, our physician organization, our billed encounters for the month, were slightly under budget, but year to date, they are still about 1% ahead of budget. So you can also see another important indicator for the physicians is how much do they spend per encounter. And if you look at having trouble with my operations here today. If you look at the net operating expense per encounter, it is favorable year to date by about 1.5%. And that 1.5% is over 79,000 encounters. So again, when we get to their income statement, you'll see where they are performing well ahead of budget. This is a graph that just kind of tells you the bigger pieces of who comprises our employed providers. And this is both physicians as well as physician extenders. And then for the month, I've already kind of shared with you, they came in about 15% under their projected budget of a $2.5 million loss from operations. Year to date, that number is $1.6 million. There's a lot of variances in here because as they try to ramp up and hire all of the budgeted providers, we have some underage and patient service revenue, but we also have some salary and benefit savings. So it all kind of washes out in the bottom line, and that is kind of the end result. So we're just under $7 million year to date.
Sharon, where do hospitalists fall on that?
The hospitalist, we contract with Sound Physicians to
Right.
provide our hospitalist services. And that is actually a coverage agreement between,
So there's no claim representation?
they are
within
not
the hospital?
employed.
Okay.
Now, Acclaim will manage the physicians themselves and some quality indicators. And we have some other large pockets of contracted. Our ED is covered by a contracted group as well,
Right.
and anesthesia.
Yep, okay, thanks.
So on the combined income statement, again, we have the hospital, Acclaim, the foundation, but the one thing that I did want to point out today is that, I'm sorry, I can't see that over there. We are actually breaking even year to date by close to $1 million from a combined standpoint. And then when you add our interest income to that, we're just over $6 million. Is there any questions on the financials today? Okay. It's me.
She's next. Sharon, good report, Sharon.
Thank you.
Entertain a motion to accept
make a
Ms.
motion to
Clark's
approve.
report. We have a motion by Mr. Powell, second by Mr. Bose. All in favor, please say aye. Opposed, motion passes.
opportunity, like Trent said, it was a good report.
Absolutely, absolutely.
Great
All right,
job,
Sharon, I
Sharon.
think you're still on deck here for item B.
I am. This is a agreement for sort of a lease with Chase. It is 16 square feet.
This is my favorite one every year.
This is where legal comes into play, right? Since it's
First Amendment.
considered real estate, I'm asking for your approval of a continuance of a 16 square foot lease space for our ATM that is positioned right outside of McDonald's in this space on the first floor.
Mr. Chairman, since it shows nothing against another bank, I would certainly make the motion to approve this for another institution that has an ATM within these walls, so I make a motion. No,
We
it's
have
not one of my machines.
not one of
That's
yours.
why I
Just
make the
clarify
motion.
that,
I
yes,
have no
not one of
conflict
yours.
in making this, or no connection with that bank, so. anyway.
Before we entertain that motion, any questions for Sharon on this item? Okay, we have a motion on the floor from Mr. Powell, second by Mr. Nguyen. All in favor, please say aye. Opposed, motion passes. Thank you, Sharon. Hia Walker, item C. Good morning, Pia.
Good morning, everyone.
Morning.
This morning, I would like to ask for your approval for the administrative service agreement for Cigna Health and Life Insurance. This is for our medical and dental benefits. For the FY19 year, the cost will be 2.37. Estimated cost is 7.1. We did go to RFP for the vendors, and this was the chosen vendor that we chose due to cost and service and relationship that they currently have with JPS.
So it's a new deal, but they're the incumbent.
Yeah,
So,
they're the incumbent, yes. This is who we have worked with for the last several years.
Got it.
Yes.
Any questions for Pia on this item? It is in budget. I will entertain a motion for approval. Motion by Mr. Bose. Second by Mr. Petty.
Okay.
All in favor, please say aye. Opposed? Motion passes.
Good, thank you.
Thank you, Pia. Dr. Duncan. No, but do you want
Good
Morning,
morning.
Karen.
Good morning, Doctor.
I always feel like I'm coming before you with a school-based clinic agreement. And again, I will not disappoint you, and I'm coming before you to consider for your approval the partnership and agreement between Arlington ISD and the Tarrant County Hospital District.
These are so important to our community.
Yeah.
So, any questions for Karen on this item? Entertain a motion. Motion, did you actually said a motion for approval? Oh, all right. Motion by Dr. Schrader, second by Mr. Bose. All in favor, please say aye.
Aye.
Opposed?
That's not opposed.
Are you opposing?
No, Mr.
Charlie
Chairman,
Powell's
I'm not-
against
I'm
school-based
not- I'm not
clinics?
opposing,
Is that what I
I
understand?
voted positive.
Oh, voted in favor. Okay, good.
You know, again, Trent reflected again on FTEs and all that earlier. This is a program, I remember not too many years ago, we said, school-based clinics, even people in the community, what is that? What's JPS getting into? And I think, again, with the current leadership we have and what we did as a board, again, we're delivering the mission of the organization to the community. So I think it's been a program I think we've been very proud of, Robert. Hopefully that fits with your long range, but it's been a tremendous program. We hear nothing but very positive things in the community for school-based
Absolutely,
clinics.
over and over. So unanimous vote. Thank you,
Thank you.
Dr. Duncan. Motion passes. Dr. Elliott. Good morning.
Good morning. Thank you for having me. I'll start with actually our first item on the agenda for consideration for approval for JPS University of North Texas Health Sciences Center GME Formula Funding Agreement. This is the next iteration of our agreement that we had one prior to this. And as you see, the amount there for $815,360 to support our graduate medical education funding there and to pass that through to us. This is for the fiscal year 19. But additionally, as you'll see reflected in the agreement will end February 29, 2020. So we also reflect an additional payment that will occur for the fiscal year 20.
Got it.
So this could be upwards to 1.7, we anticipate.
Okay. Pia, in terms of the pass, I'm sorry, Dr. Elliott.
Yeah.
In terms of the pass-through, the 80/20 piece?
Yes.
Is that standard?
It's not necessarily standard. It was something that we actually had negotiated prior, considering that we had not had an agreement in place before, and really wanting to support some additional activities for our faculty through the academic health center model, which we do need to have some of that for our teaching programs.
Right.
So that's where we have supported some faculty development activities. We're actually going to be exploring, now that they have some new leadership, some additional opportunities to support our faculty and our residency programs.
And
with
that's what they're
20%.
getting for or what they're
20%.
providing for their 20%.
Yeah, and we'd like to see even more from that. So we'll be negotiating that this year
great,
and looking
okay.
at what that reflects for us too.
Oh,
Yeah.
Second.
Thank you. Yeah. Next item, considering approval for a Fourth Amendment to the Medical Education Affiliation Agreement between Oral and Maxillofacial Network and our Tarrant County Hospital District. This is in support of our OMFS program and supporting the educational activities and the programmatic activities supporting our OMFS residency program. As you'll see, the term over 35 months and the cost there, and this corresponds with our practice management service agreement also.
got it. Heard Dr. Elliott's explanation. Any questions?
So moved.
Motion by Dr. Petty. Mr. Petty,
My question is, what are you a doctor of?
you don't want to know. Second by Mr. Bose. All in favor? Please, all opposed? Motion passes. Thank you very much.
Thanks, everyone.
Kenny Carr. Item G. Good morning. Okay.
So I would like for everyone to consider the approval of the purchase agreement between Part Source, Inc. in the Tarrant County. Part Source, Inc. is a vendor that we utilize to supply us with parts for our clinical engineering department so that we can maintain all of our equipment. It is a 3-year agreement at a cost of about $320,000 a year for a total of about $960. They allow us to do a great job about sourcing our parts.
So we source our parts from Part Source. I could have sworn that was an auto parts place when I read that. Any questions for Kenny on this item?
It's hard to get a defibrillator there, sir.
There you go. All right, entertain a motion. Motion for approval from Mr. Nguyen, second by Dr. Schrader. All in favor, please say aye. Opposed? Motion passes. Thank you, Kenny.
Have a great day.
You too. Wanda People.
Good morning.
Good morning.
The first contract I would like to present is your consideration between Alcon Laboratories and the hospital district. And this is used by our ophthalmology department for our eye implants, packs, and supplies. We did put this out for RFP and only got one respondent. But when they came back, came back with a price increase, so we renegotiated that for an additional $40,000 to $45,000 annually.
We didn't get a hometown discount or anything?
Yeah, they're not hometown. They're not hometown.
I know. Any questions for Wanda in this item? Yes, sir. Please.
A while back, we agreed that we were not going to separate interns from residents, and we're going to use the term residents to include all the people in training, and this one has residents and interns.
Oh,
Good point.
Just minor sort of housekeeping
so noted.
thing.
Okay.
Noted.
Correct.
Any other questions for Wanda? I'll entertain. Motion by Dr. Weber, second by Mr. Nguyen. All in favor, please say aye. Aye. Opposed? Motion passes. Thank you. Next item, Wanda.
Our next agreement is with Johnson & Johnson Healthcare Systems and the hospital district, and this is for our implants that's used currently by the orthopedic surgeons, neurosurgeons, and trauma procedures. Primarily things like pedicle screws, those type things. We did put it out for an RFP. We did have 4 respondents and landed with the Johnson & Johnson product, which is DePuy and Synthes. This will give us a savings of $66,443.
Great.
And will lock us in for 3 years with this pricing.
Any questions for Wanda?
Move approval.
Motion by Mr. Bose, second by Dr. Weber. All in favor, please say aye.
Aye.
Opposed, motion passes. And item J is here because it's a sole source, correct?
Yes.
Yeah.
This is the only company in this area that supplies this product. This is for our breast milk mothers, with the Mothers Milk Bank of North Texas. This supplies us with breast milk for those mothers who want to breastfeed, but for some reason they have an infection or something, but want to keep their babies on breast milk. So this will lock us into pricing for 5 years without an increase, so as this contract came up for renewal.
Right, so the motion on this, if to approve, we need to, right, I'm way ahead of you, I'm like lapping you and stuff. Is two part. One is to approve the exemption to competitive bidding, and the other is approval of the item itself. So I'll entertain a motion.
Recommend approval of the sole source and for the agreement.
Motion by Mr. Bose, second by Mr. Nguyen. All in favor, please say aye.
Aye.
Opposed? Motion passes. Thank you, Wanda. Report of legal. Scott?
Mr. Chairman, there were 41 contracts that are under $500,000 for the month of January. They're posted to the board's web portal for your review.
Okay. Any questions for Scott on any of those items? All right, we're going to reconvene in executive session for a briefing from our CEO.